Hello everyone, welcome back to the channel. Today we're diving into a topic that so many people ask about but rarely find clear, realistic answers for: how to tighten the thighs and specifically target that stubborn inner thigh fat. Even though spot-reducing fat isn't something the body naturally does in isolation, there are scientifically supported strategies and practical lifestyle habits that can help reshape the thighs, improve muscle tone, and reduce overall body fat in a way that noticeably changes the look and feel of the inner thighs. In this video-style script, I'll walk you through the concepts, the exercises, the lifestyle changes, and the realistic expectations you should keep in mind. By the end, you'll have a complete guide you can follow with confidence and without confusion. One of the first things people notice when they start working on their thighs is that the inner thigh area responds differently from the outer thigh or glutes. This area tends to accumulate soft, persistent fat because of genetics, hormonal patterns, and lifestyle habits such as long hours of sitting or lack of targeted lower body movement. The inner thighs are also made up of a group of muscles called the adductors, which don't get activated in many of our everyday movements. So before we even talk about fat reduction, the first key is learning how to wake up and strengthen these muscles. When you build these muscles, you help tighten the area, increase your overall lower body strength, and create the shape you want once fat begins to drop. But even before exercises come into play, it's important to understand how fat loss works. Your body doesn't pull fat from a single area just because you focus on it. What you can control, however, is increasing overall activity, reducing overall fat, and building the muscles under the skin so the area becomes firmer and tighter. When you combine the right exercises with a consistent routine and smart nutrition habits, that's when the inner thighs begin to transform. So think of this process as teamwork between nutrition, strength training, cardio, and consistency. No single element works alone. Let's start with the concept of muscle activation. When you perform certain movements, such as squats or lunges, you may be working your legs, but the inner thighs are only partially involved. To really tighten this area, you need exercises that specifically pull the legs toward the midline of the body. Movements such as side, lying leg lifts, inner thigh squeezes, wide sumo squats, and glute bridges with a ball or pillow between the knees are excellent for engaging the adductors. These exercises don't just help with shaping, they improve stability, balance, and the ability to activate the right muscles during compound movements. When you start activating the inner thighs consistently, you'll notice a difference in muscle control within a couple of weeks. Another key part of transforming the thighs is improving circulation and reducing water retention in the area. Inner thigh softness isn't always just fat. Sometimes it's fluid retention caused by long periods of sitting, high sodium intake, or lack of proper hydration. When you hydrate well, reduce excessive salt, and move your legs regularly with walking, stretching, and low-intensity cardio, the thighs start to appear firmer even before significant fat loss happens. This is why people often feel their thighs look better after just a few days of lifestyle adjustments. Now, let's talk about strength training in a little more depth. Strength training is not only for building muscle, it's one of the most effective ways to burn fat, especially around stubborn areas. When you perform movements like sumo squats, lateral lunges, and plie squats, you're simultaneously burning calories and building the inner thigh muscles. These movements create mechanical tension, which signals the body to grow muscle fibers. And because muscle tissue burns more calories at rest than fat tissue, increasing muscle in your thighs raises your metabolic rate. This means your body becomes more efficient at burning overall fat, which eventually leads to fat being pulled from stubborn pockets, including the inner thighs. One exercise people often underestimate is the sumo squat. Because of the wider stance and the outward rotation of the toes, this movement activates the adductors far more than regular squats. When done correctly, you can feel the inner thighs working intensely, and this repeated activation helps build firmness and shape. Pairing sumo squats with slow, controlled pulses at the bottom of the movement increases time under tension and gives even better results. Over time, these movements help tighten the inner thighs and give them a more sculpted appearance. Let's move into another essential element, consistency. Many people start an inner thigh routine but stop within 2 weeks, thinking they aren't seeing results. But remember that stubborn fat takes longer to reduce. The inner thigh area often responds at a slower pace because the fat cells there may be more resistant to mobilization. This doesn't mean the plan isn't working, it means the process takes time. The key is staying consistent with targeted exercises at least 3 times per week, combined with full body strength training and regular cardio. Most people begin noticing improved muscle tone within 4 weeks and noticeable fat reduction within 6 to 12 weeks, depending on effort and genetic factors. Now let's talk about cardio. While inner thigh exercises build and tighten the muscles, cardio helps with overall fat reduction. Not all cardio is equal when it comes to shaping the thighs. High-intensity interval training, brisk walking on an incline, stair climbing, and cycling are all effective ways to increase calorie burn while engaging the lower body. When you combine these with your inner thigh exercises, you improve both muscle and fat burning efficiency. For example, incline walking activates the lower glutes and thighs without adding bulk, while stair climbing shapes the legs by targeting a range of lower body muscles. Nutrition plays an equally important role. If the goal is reducing stubborn fat, you need to support your body through balanced, nutrient-dense eating. This doesn't mean starving yourself or following extreme diets. It means focusing on lean proteins, whole grains, vegetables, and healthy fats, while reducing processed sugars and excessive refined carbs. Protein is especially important because it supports muscle repair and growth. When you increase muscle while maintaining a slight calorie deficit, the body naturally starts pulling fat from reserves, including the thighs. You don't need drastic calorie cuts. Small, steady adjustments lead to sustainable fat loss and long-lasting firmness. Let's shift for a moment to posture and everyday movement. Many people don't realize how posture affects the thighs. When the pelvis tilts forward due to weak core muscles or long hours of sitting, the thighs can appear softer or less toned. Strengthening the core and practicing good posture during walking, standing, and exercising enhances the appearance of the legs. Even simple habits like standing with weight evenly distributed, not leaning into one hip, or avoiding turned knees can make a difference. Another factor that contributes to stubborn inner thigh fat is hormonal balance. Stress, lack of sleep, and elevated cortisol levels can make fat reduction harder, especially around the lower body. While you can't control every hormone directly, you can support your body through high-quality sleep, regular physical activity, hydration, and stress relief practices like deep breathing or stretching. When the body feels balanced, it responds better to exercise and fat loss efforts. Now let's discuss some of the most effective targeted exercises you can include in your routine. One great movement is the side lying inner thigh lift. This exercise isolates the inner thigh and allows you to focus fully on the adductors. Another powerful variation is the elevated leg lift, where you place the top leg on a pillow or block and lift the lower leg upward, which increases the range of motion. You can also use a resistance band or a small ball between your knees during glute bridges to force the inner thighs to stay activated. These simple tools can amplify your results without requiring heavy weights. Another extremely effective movement is the curtsy lunge. Even though it primarily targets the glutes, it indirectly engages the inner thighs because of the cross leg motion. When you focus on control and form, curtsy lunges help sculpt the thighs and improve overall hip stability. Pairing them with lateral lunges creates a dynamic combination that strengthens and tightens the inner thighs from multiple angles. In addition to strengthening, mobility work also helps the thighs appear longer and more toned. Tight hip flexors or tight hamstrings can pull on the pelvis and create imbalances that affect the appearance of the legs. Stretching the hips, glutes, hamstrings, and adductors increases flexibility and improves the aesthetic lines of the thighs. Movements such as butterfly stretches, frog stretches, and wide leg forward folds help release tension while supporting blood flow to the area. One thing many people overlook is the importance of slow, controlled repetitions. When you rush through exercises, momentum does the work instead of your muscles. Slow reps increase muscle engagement, create deeper activation, and make every movement more effective. This is particularly important for tightening areas where the muscles may be undertrained, such as the inner thighs. For example, performing slow, deep plie squats while keeping the knees externally rotated engages the inner thighs far better than fast, shallow movements. Let's take a moment to talk about realistic expectations. Transformation takes time, especially in areas with stubborn fat. However, inner thigh changes can happen when you stay consistent with targeted workouts, full body training, and balanced eating. Most people begin feeling stronger within 2 weeks, moving better within 3 weeks, and noticing visual changes within 1 to 2 months. The key is to stay patient and trust the process. Another great strategy is combining low-impact and high-impact days. For example, on one day you might focus on slow muscle building movements like sumo squats, inner thigh lifts, and bridges. On another day, you can add dynamic movements like lateral hops or step-ups to create more calorie burn and athletic engagement. This balanced approach helps you get both fat burning and muscle tightening benefits without overworking your joints. Now let's talk briefly about home equipment. You don't need much to tighten your thighs. A resistance band, a small exercise ball or pillow, and maybe a mat are enough to get excellent results. Resistance bands are especially useful because they activate stabilizing muscles, increase resistance without heavy weights, and help maintain form. Using a ball for thigh squeezes or bridge variations increases inner thigh engagement significantly. Even if you prefer to stay minimal, bodyweight exercises can still transform your thighs when done consistently. Massage can sometimes help improve the appearance of the thighs by enhancing circulation and reducing temporary puffiness. While massage does not remove fat, it can make the thighs look smoother and more toned, especially when combined with exercise and hydration. Techniques such as dry brushing or simple leg massages can support lymphatic flow and muscle recovery. Let's move on to the importance of overall leg strength. Strengthening the quads, hamstrings, and glutes helps support the thighs and creates a balanced shape. When the glutes are strong, they help lift and tighten the whole leg area. When the hamstrings are engaged properly, they support the thigh line and reduce the appearance of sagging. A well-balanced lower body creates better definition and enhances the visual effect of inner thigh tightening. Another point to consider is the role of gait and walking technique. Over time, the way you walk can influence which muscles stay active and which muscles weaken. If your knees collapse inward when you walk or squat, your inner thighs might be underactive, contributing to softness. Practicing proper alignment helps activate the correct muscles and improves the look of the thighs over time. Hydration is also key. When your body is dehydrated, your skin can look dull, and water retention may increase. Drinking enough water helps maintain elasticity, supports muscle recovery, and encourages your body to flush excess fluids. This can make your thighs appear tighter even without major fat loss. Let's take a moment to talk about mindset. Many people compare their progress to others online, forgetting that bodies differ in genetics, muscle structure, and fat distribution. What matters is improvement, not perfection. Your thighs will respond to consistent effort and proper training, even if the timeline differs from someone else's. Focus on how your body feels stronger, how movement becomes easier, and how your confidence grows. These changes matter just as much as visual results. Now let's walk through some example routines you can follow. A simple but powerful routine might include plie squats, lateral lunges, inner thigh leg lifts, and bridge squeezes. Another day, you might do incline walking, stair climbing, or interval cycling. Alternating between strength and cardio gives the best results for stubborn areas. After each workout, stretching the inner thighs, hips, and hamstrings helps prevent tightness and supports recovery. Recovery is often overlooked. Muscles grow and tighten during rest, not during exercise. Sleeping well, staying hydrated, and allowing your muscles to recover helps you see quicker improvements. Overtraining can actually slow progress by causing fatigue and inflammation. A balanced schedule with rest days is essential. To wrap this up, remember that tightening the thighs and reducing stubborn inner thigh fat is about combining activation, strength training, cardio, healthy eating, mobility, and consistency. No single method will work alone, but together they create powerful, lasting transformation. If you stay committed and patient, your thighs will become tighter, stronger, and more defined over time. Keep pushing, stay focused, and trust that every workout, every meal choice, and every step is moving you closer to your goal. Thank you for joining me today. If you found this script useful, stay tuned for more content designed to help you transform your body with realistic, science-based methods.